Welcome to the Careers in Healthcare Spotlight podcast. In this series, we dive into the real world experiences of healthcare professionals and explore the university resources available to help students succeed in their academic and professional career paths. Today, I'm joined by Dr. Jessica Provines, a passionate community and clinical psychologist whose journey began as a first-generation transfer student at Wichita State. Inspired by her own mental health challenges and the loss of loved ones to suicide and overdose, she founded Health Outreach, Prevention and Education Hope Services at WSU, and co-created Suspenders for Hope, a national mental wellness and prevention initiative. Now serving as Assistant Vice President for Wellness and Chief Psychologist at WSU, she leads strategic efforts to promote holistic well-being on campus and in the broader community. Welcome, Dr. Provines.
Oh, thank you so much for having me, Sarah. I appreciate you inviting me for this podcast and sharing what I might be able to share to help those exploring these careers.
Yes, thank you. I wanted to start out by asking you what inspired you to pursue a career in psychology, and how did you get to where you are today?
Mm-hmm. Well, the initial inspiration really started from my first psychology class. It was a freshman course that I was taking at another state university, and I loved it. It didn't feel like work to me. It just felt very interesting, and I was really intrigued by the material. And then when I transferred back to Wichita State to be closer to home, as you shared, that was a difficult year for me. I had lost connection with a lot of my friends. I'd gone through a breakup, and before I knew it, I was feeling very lonely, very isolated, very disconnected on a big college campus. And I experienced my first clinical depression. And so I kept taking psychology courses, I think in some way to, heal thyself. And I had no idea that there were quality mental health services available to me as a student on campus through the Student Counseling Center, because we just did not talk about mental health in the late 90s, thankfully, the way we are beginning to do today. We've done a lot of work on reducing the stigma, but there's still a lot to be done. And so it took me a few routes, and I had a few different majors that I changed, and no one had talked to me about all the different careers that are available in mental health. And I really had to explore that on my own, and have learned that there are multiple paths to the kind of work that I was interested in doing. I wanted to do therapy and direct services, working, one-on-one with individuals and families and couples, and had no idea that there were all these different paths. So I kind of clumsily found my way, had some great advisors who told me to get involved in undergraduate research, and Wichita State had a program in community clinical psychology. So I had worked with one of the professors and got some good recommendations and reference letters, which are important if you're wanting to pursue graduate studies. And that's just where I landed. I wish I could say that I had explored a lot of my career options, but I didn't. And I didn't really know all the paths. So I'm glad to be here today to help illuminate, maybe what some of those different options might be for folks.
Yes. And speaking of careers, what are some of the most common career paths for psychology majors, both clinical and non-clinical?
Yeah. So, a psychology bachelor's degree is a very versatile degree. You're really learning about human behavior. And so there are multiple careers where, being in management, being in social services, a background in psychology would be super helpful. But if you want to do direct service and be licensed as a mental health care provider, then you need to pursue a higher level of education, a master's or a doctorate degree, and pursue a license. So some of the bachelor's level careers, like I said, you could get into management, but if you're wanting to stay in the mental health field, There's lots of case management jobs, sometimes parole officers, working in different social service industries directly, helping people to access services is a very viable career option.
Oh, good. And you talked a little bit about degrees or certifications needed for different psychology degrees, and that grad school isn't always necessary. But can you I know you went through the Wichita State program, so you may be familiar with kind of the steps that they have. So we have undergrad. Can you talk more about the options through the psychology program at Wichita State?
Yeah, so at Wichita State, we have a bachelor's in psychology, and then we have three different PhD programs. And those PhD programs are in community clinical psychology. And so that's the one program that would be license eligible, providing direct clinical care to populations. And then the other program is a community psychology program. And so that degree focuses on doing research on like program development, program evaluation, really trying to create and evaluate programs that are to scale to try and improve the health and well-being of communities and populations. And then there's the human factors psychology program here at Wichita State, which is a really interesting degree and study of the interaction of humans and machines. So graduates from that program often go on to work for big corporations like Google, Apple, helping to design machines and products that are user-friendly and that are that just ergonomically make sense for how humans work. So they conduct that kind of research on designs.
Awesome. And that's really interesting how that probably works too.
It is.
Um, since you were on the clinical psychology side, can you talk about what a typical day looked like in your field when you were practicing and doing counseling, and what are some common misconceptions?
Mhm. Oh, so as a licensed psychologist in the state of Kansas, after I completed my training, which typically in clinical psychology, there's a 4-year academic program, and then there's a required internship. And that internship is a national matching process, which is very similar to medical residence programs. We use the same company to do a match. So all intern eligible students and all internships are doing their interviews at the same time. And then there's a rank order matching process. And then there's a match day
Oh,
where you
wow.
find out where you might be going. And so I had applied to so many places after completing, my 4-year academics here. And I didn't know where I would be for internship. But thankfully, I placed here
Yeah.
at Wichita State University Counseling Center. And so there's many different kind of settings where clinical psychologists can work. You can work in hospital settings, working on inpatient units with acute and severe patients that might be experiencing immediate suicidal threat or psychosis and needing stabilization. You can work for community mental health centers that are serving the underserved in the community through direct clinical services. You can go into private practice as well and go into business with yourself or with a group of other clinicians providing outpatient services. There are some that work in hospitals or integrated care settings, so they might work alongside traditional medical providers and being able to really integrate care and have warm handoffs, between the physical health and the mental health. And so university counseling is where I ended, and it's a wonderful career. I did my internship here. I loved it. I loved working with emerging adulthood. I loved supervising graduate students. That's a big part of what university counseling centers do is they align with the university academic mission, and oftentimes many of their counseling programs will be doing internships and practicums. So I was able to do clinical supervision and also able to do a lot of outreach and workshops and prevention and education to campuses. So we'll go in and do guest lectures in classrooms and talk about, stress management or suicide prevention or substance use disorders and just, destigmatize mental health. So there's a lot of variety into what you can do at a university counseling center in addition to, doing that one-on-one therapy with students at the university.
So you talked a little bit about the services that our counseling and psychological services provides. Can you talk about like the outreach, but just talk about like the experience students would have if they needed to, you know, go to CAPS for whatever reason?
Yeah, here at Counseling and Psychological Services, we are very lucky in the fact that we are able to get students in very quickly. Our average wait for an appointment is usually 3 to 5 business days for a routine intake. However, we also have multiple appointments daily for students who might be experiencing a mental health crisis or a safety emergency. And so we can get students in same day if there is a safety issue. So typically they would schedule an appointment. They would meet with their counselor to kind of go over their personal history and their goals and to develop a treatment plan. And then we really right-size treatment for students. I think the average number of sessions is anywhere from 6 to 8 individual sessions where you're probably going to be meeting every other week. If it's more severe, maybe weekly, one-on-one with a therapist. And then we also have group therapy services where there are just some issues that are better dealt with your peers and kind of learning, how do I interact with my peers? How do I feel less alone? How do I overcome social anxieties? And so you may be referred to a group service, and that would be a student's choice if they wanted to do that. We also coordinate with our student health services, which manages the mental health medications. And so after meeting with your therapist, you may think, well, a referral for a medication consultation may be good. And so then we would refer you to student health to then meet with one of the nurse practitioners and to determine if medications would be helpful. And many of those medications we stock here in our drug room at the Student Wellness Center. So there are some prescriptions like controlled substances, for example, that students would have to fill off campus. But we can fill a lot of those right here on campus. Our building is on campus in the YMCA and the Student Wellness Center located inside that building. So really accessible for students.
Yeah, for sure. And I know that the group counseling may sound scary, but I do think that, it can be very helpful to hear from your peers that they're struggling with the same or similar, because you can feel like it's just me if, you're in your dorm room thinking, oh my gosh, it's only me. But honestly, probably half the campus is having the same issue you are, if not more, in some
Absolutely.
areas.
I totally agree with you. And we just really encourage people, talk about your mental health. We
Yes.
need to. And the more we talk and are open about it, the more we reduce that shame and that stigma, and the more we realize that we're not alone.
Yes.
And so it helps us heal, helps us connect with others. And yeah, it's great. The magic that happens in group therapy is real. And we don't turn any student away for inability to pay. It's only $10 to meet with one of our counselors, but we will also reduce those fees if that is outside of a student's budget. So finances should never be a barrier for our Wichita State students getting the help they need.
That's great. And I would say as faculty, we have seen more and more like mental health is an issue for our students. So can you just talk quick about like how a care report works? So when a faculty maybe does submit a care report on a student, how does that process work?
Yes, and so the care process is separate from the counseling department. I always
Mhm.
like to make that clear. Sometimes people think that CAPS is the care team, and that's not the case.
Right.
CAPS is a confidential treatment provider where all of your information is completely protected health information with your therapist. Now, the care team, which I do serve on that team. I'm the kind of the mental health consultant to that team. Um, Reviews reports that come in on students, and it could be for a variety of issues. It might not be mental health related. It could be financially related. It could be transportation related. It could be academically related. It could be, food insecurity related. Any concern that is impacting a student's life and their well-being and their success at the university can be brought to the care team's attention, and then the care team does a good job of being the bridge and trying to connect those students to the resources that might be able to help. It may be you need some financial management and budget training, or you might need to connect with the chakra support locker. And so or you may need some help coordinating with your professors if you have to be out of classes for like a death in the family or something. Or it may be that a student is experiencing some severe mental health concerns and worried about their safety. And so then a case manager who works in the um, uh, the SOS team, a case manager with
Yeah.
the SOS team uh, would reach out to a student, meet with them, determine what their needs are. And if a mental health referral is needed, then they would help connect the student to us. So I like to separate those and make sure that students know that they're separate, but it really shouldn't be anything that students are concerned about. This is the university trying to wrap around students to make sure they don't fall through the cracks and help students proactively engage in the services that we've always had here,
Yes.
that sometimes students don't know about, and to get the support that you need so you can be successful at Wichita State.
Yes, and I like that it helps connect students to those services so that as a student, if you're in some type of crisis, you're not the one having to step out and make those connections. The care team is really helping to facilitate that process. I know we kind of went off topic with both of those things, but I wanted to make sure that students knew about, CAPS and the care team and how these services are here to help them be better students and to get all of their needs met.
Absolutely. I think it's great that we're elevating that and helping to make sure students are aware. But also it's important, for careers in mental health or psychology, to know that you are not on an island, that you're
Right.
part of a team. And that's one of the things I love about working here at Wichita State is that there are a team of professionals to help students, and mental health treatment is just one aspect of overall
Yes,
wellness.
that's important. And we talk a lot about interprofessionalism in the College of Health Professions, and you're just part of that interprofessional team working to help individuals, whether it be healthcare or outside of the healthcare system.
Absolutely.
Now, back to kind of our topic, how do you see the field of psychology evolving in the next 5 to 10 years, and what trends should students be aware of?
Mhm. Well, there's definitely a high demand for psychology services, and so if you are interested in pursuing this, there will definitely be careers out there. I don't know very many unemployed psychologists, not of their own choice. So we're really in high demand. Some needs for psychology are that formal psychological evaluation and assessment. So things like psychological testing to help tease out diagnoses around like autism and learning disabilities, and those are really needed. Forensic assessment, competency to stand trial kinds of assessments. So if you're someone who likes puzzles and things like that, There's a really high need for a formal evaluation and psychological assessment in the field. And that would be a great thing to look into and to pursue. Um, I think a lot of our mental health counseling jobs, one of the fastest growing careers in mental health is the uh, the licensed professional counselor. And so here at Wichita State, in our College of Applied Studies, there's a mental health counseling program, and that is a master's degree in counseling. And that's one of the fastest growing fields for providing that direct service in the state of Kansas. And so I see in some ways you might have your master's level, your clinical social workers, your mental health counselors, sometimes your licensed marriage and family therapist, your licensed master's level psychologist, which Emporia has a program in our state at the master's level. I see some of those growing to fill the gap and the need for outpatient mental health services, and I see psychology kind of serving more as that specialized niche and doing research and doing that formal assessment.
Thank you. Do you have any advice for the students looking to gain experience and how to stand out in the job market?
Mhm. Well, I remember the advice that my academic advisor gave me, and particularly if you're wanting to pursue graduate studies, she was like, you get involved in undergraduate research. That is really going to help you stand out as an applicant, particularly if you're wanting to pursue a PhD in psychology, because they are PhD programs, and so they're highly focused on research. And so you need to show that you have that research experience. I know we have a new initiative here at the university um, out of the library, the undergraduate research hub, which is trying to connect undergraduate students who are interested in pursuing research and graduate studies to connect them with faculty who are conducting research. So I highly recommend doing that. That will absolutely help. And then to take those experiences very seriously. I had
Yes.
my academic advisor told me this is a job interview for a
Hmm.
whole semester. She was like, you have to show up every day like you're on a job interview because those experiences can either help you or they can hurt you. And your
Hmm.
goal is to get those strong letters of recommendations to get into those programs. So you really want to take those seriously and put your best foot forward as you're trying to stand out and apply to competitive programs.
Yeah, that's really good advice. Is
Mhm.
there anything else you would like to share before we wrap up?
Yeah, I would just say, many people that are interested in psychology are like me. They wanted to help people, they wanted to be a therapist, but they may not really know what those paths are. And so I highly encourage you to check out the Kansas um, Behavioral Sciences Regulatory Board webpage. The Kansas BSRB is the licensing entity for all mental health professions that would be providing direct care in the state of Kansas. And so that will show you what are some of the different paths to licensure, what credential do you need for independent license? And like I said, there's many different options. Psychology isn't the only option. So I would encourage you to get familiar with that, but then to realize that every state is different. And so maybe
Yes.
one degree or one license that we have in Kansas may not transfer to another state that you're wanting to practice in. So you'll want to get familiar with the state where um, want to work, want to pursue your career, and make sure that whatever you're pursuing here will be transferable to the state where you want to go. So I think that's something that I didn't learn about until later. And so I really encourage people to check that out.
Yeah, that's good advice too. Well,
Mhm.
thank you so much for joining me today and talking about all things careers in psychology and mental health. I really appreciate it.
Well, I appreciate you having me, Sarah. Thank you. And thank you to all the students who are listening. I really wish you well in your academic and career journeys and know that you're making a great investment here at Wichita State.
Thanks.